Overcoming common challenges in e-prescribing. While e-prescribing has proven to be a valuable tool in modern healthcare, its implementation and ongoing use can present various challenges. These challenges range from technical barriers and workflow issues to data mismatches and patient concerns. Identifying and addressing these challenges is essential for ensuring that e-prescribing systems operate smoothly, safely, and effectively for both providers and patients. 1. Technical and workflow barriers to effective e-prescribing. The successful adoption of e-prescribing requires robust technology, seamless workflows, and integration with other healthcare systems. Common technical and workflow barriers can hinder the smooth functioning of e-prescribing systems. 1.1. System integration. Challenges. Problem. Many healthcare providers use disparate systems for electronic health records, EHR, pharmacy management, and e-prescribing. Lack of integration between these systems can lead to inefficiencies, delayed prescriptions, and incorrect information being shared between systems. Solution. To overcome this, healthcare organizations must prioritize choosing e-prescribing systems that integrate with their existing EHR and pharmacy management systems. Additionally, adopting standardized interfaces, such as HL7 or FHIR, can improve interoperability and ensure that data flows smoothly between systems. 1.2. User training and workflow. Disruptions. Problem. Providers and pharmacy staff may struggle with adopting new e-prescribing technologies due to insufficient training or resistance to change. This can lead to errors, inefficiencies, and frustration, impacting patient care. Solution. Regular training programs and user-friendly interfaces are crucial for ensuring that all parties involved in the e-prescribing process can use the system efficiently. It's also helpful to implement workflows that complement existing processes, minimizing disruption and making the transition to e-prescribing as smooth as possible. 1.3. System downtime and reliability issues. Problem. Like any technology, e-prescribing systems can experience technical glitches, outages, or downtime, leading to delays in prescription processing and potential disruptions to patient care. Solution. Having backup systems and contingency plans in place is essential. E-prescribing solutions should offer reliable customer support, and healthcare organizations should be prepared to handle downtime by using manual processes or temporary workarounds, such as faxing prescriptions when necessary. 2. Managing errors and mismatches in patient data. Accurate patient data is essential for effective e-prescribing. However, mismatches, incomplete records, or errors in patient data can cause serious issues that affect the safety and efficacy of prescribed medications. 2.1. Inaccurate or incomplete patient information. Problem. If a patient's medical history, allergies, or current medications are not updated or accurate in the e-prescribing system, it can lead to prescribing errors, drug interactions, or adverse reactions. Solution. Ensuring that the system has up-to-date patient information is critical. Regular audits, verification processes, and integration with other healthcare databases, e.g., prescription drug monitoring programs or medical claims data, can help maintain accurate records. Additionally, e-prescribing platforms should include tools for providers to quickly verify patient data before sending prescriptions. 2.2. Medication. Mismatches. Problem. If the system fails to match a prescribed medication with the correct drug in the pharmacy's inventory, it can result in patients receiving the wrong medication or dosage. Solution. E-prescribing systems should integrate drug databases and clinical decision support systems, CDSS, to ensure that the prescribed medication is available at the pharmacy and that dosage information aligns with recommended guidelines. These systems can also flag potential drug interactions, allergies, or contraindications before the prescription is transmitted to the pharmacy. 2.3. Prescriber and pharmacy errors. Problem: errors can occur when prescribers select the wrong drug, dosage, or form, e.g., tablets instead of liquid, or when pharmacists incorrectly interpret or fill the prescription. Solution: e-prescribing systems should be designed with error prevention mechanisms, such as drop-down menus for drug selection and automated alerts for potential discrepancies. Providers should also review prescriptions carefully before submission, and pharmacies should implement double-checking protocols to confirm the accuracy of the filled prescription. Third, addressing patient concerns and technological access issues. Despite the benefits of e-prescribing, patients may have concerns regarding the technology, especially related to privacy, accessibility, and communication. Ensuring that patients understand and trust the e-prescribing process is key to its success. 3.1. Patient privacy concerns. Problem: patients may be concerned about the privacy and security of their personal health information when using e-prescribing systems, especially in the context of data breaches or cyber attacks. Solution: healthcare providers and pharmacies must adhere to strict privacy regulations, such as HIPAA, and ensure that e-prescribing systems use encrypted communication channels. Educating patients about the safety and benefits of e-prescribing can also help alleviate concerns, emphasizing the security measures in place to protect their data. 3.2. Technology access and digital literacy problem. Not all patients have access to technology or are comfortable using it, particularly older adults or those living in rural areas with limited internet access. This can lead to frustration if patients are unable to receive prescriptions electronically or if they are not familiar with digital health tools. Solution: to address these issues, healthcare providers should offer alternative methods for patients to communicate prescription needs, such as phone calls or paper prescriptions for those without access to e-prescribing systems. Providers can also work to improve patient education around e-prescribing by offering resources on how the system works and what to expect during the process. 3.3. Pharmacy access and adoption issues. Problem: not all pharmacies may have the technological capacity to receive and process e-prescriptions, especially independent pharmacies or those in areas with limited resources. Solution: healthcare providers can work closely with pharmacies to ensure that they have the necessary tools and support to implement e-prescribing. Community outreach and partnerships with pharmacies can help foster broader adoption and ensure that all patients benefit from the technology. Integrating e-prescribing in multi-provider settings. In multi-provider healthcare settings, such as hospitals, outpatient clinics, and integrated health systems, e-prescribing must be effectively coordinated across various departments and providers to ensure consistent, high-quality care. This requires collaboration, efficient technology, integration, and clear workflows. Integrating e-prescribing into such settings can improve patient safety, reduce prescription errors, and ensure the continuity of care. 1. Coordinating prescriptions across multiple healthcare providers. When multiple providers are involved in a patient's care, ensuring that prescriptions are properly coordinated is critical for patient safety and treatment efficacy. 1.1. Clear communication and workflow integration. Problem: in multi-provider settings, patients often see various specialists or visit different departments, which can result in fragmented care and a lack of coordination in medication prescribing. Solution: e-prescribing systems in multi-provider settings should integrate with the broader electronic health record (EHR) system, allowing all authorized providers to view and update a patient's medication list. This ensures that prescriptions are consistent and that providers are aware of any medications prescribed by other members of the healthcare team. Additionally, defining clear workflows for medication management across providers can help prevent duplication, omissions, or harmful drug interactions. 1.2. Shared decision-making. Problem. When different providers prescribe medications without full knowledge of each other's decisions, it can lead to conflicting or redundant treatments, potentially causing adverse drug events. Solution. E-prescribing systems with shared access to patient records allow healthcare providers to collaborate more effectively in prescribing. Physicians, specialists, and pharmacists can communicate and make decisions together, ensuring that treatment plans are optimized and avoid unnecessary prescriptions or conflicting medications. 1.3. Centralized medication management. Problem. Without a centralized system for medication management, patients may receive different prescriptions for the same condition from multiple providers, leading to confusion and errors. Solution. A centralized e-prescribing system that consolidates prescriptions from all providers into a single platform can ensure accurate tracking of medications, dosages, and treatments. This provides a holistic view of the patient's medication history, helping to avoid medication errors and ensuring that any changes in treatment plans are reflected across all providers. 2. Shared access to medication history and patient records. One of the key benefits of e-prescribing in a multi-provider setting is the ability to share comprehensive medication histories and patient records, which fosters coordinated care. 2.1. Real-time medication. History access. Problem. In multi-provider settings, providers may lack access to comprehensive medication histories, which can result in prescribing errors or unsafe medication choices, particularly in patients with complex health conditions. Solution. E-prescribing systems integrated with EHRS provide real-time access to a patient's complete medication history. This includes information about past prescriptions, medication allergies, and any changes in treatment plans. Providers can use this shared data to make informed prescribing decisions, minimizing the risk of medication errors and adverse interactions. 2.2. Medication reconciliation. Problem. In settings where patients see multiple providers, it can be difficult to ensure that medications are accurately reconciled, leading to potential drug duplications or omissions. Solution. E-prescribing systems facilitate medication reconciliation by providing a clear and up-to-date list of all medications the patient is currently taking. This allows providers to review and update the patient's medication list at each visit, ensuring that prescribed medications are aligned and that all relevant treatments are accounted for. 2.3. Collaborative tools for shared records. Problem. In large healthcare organizations, different departments or practices may operate using separate EHR systems, making it difficult to share medication histories and treatment plans effectively. Solution. Using interoperable e-prescribing systems that support data exchange between different EHR platforms ensures that all providers, regardless of their department or system, can access shared medication data. Interoperability is crucial for maintaining the continuity of care and preventing prescription errors due to gaps in patient records. Third, best practices for ensuring consistent, high-quality prescribing. In multi-provider settings, maintaining high-quality prescribing practices is essential to ensuring patient safety and positive health outcomes. 3.1. Standardized prescribing protocols. Problem. Variability in prescribing practices among different providers can lead to inconsistent treatments, which may affect patient safety and treatment outcomes. Solution. Establishing standardized prescribing protocols across all providers in a multi-provider setting can help ensure consistency. E-prescribing systems can be set up to support clinical guidelines, formulary restrictions, and institutional preferences, ensuring that providers adhere to best practices and evidence-based recommendations. This minimizes the risk of prescribing errors and ensures that all patients receive care based on the latest medical standards. 3.2. Clinical Decision Support Systems, CDSS. Problem. Even with e-prescribing, the risk of medication errors, such as drug interactions or inappropriate dosages, remains if providers do not use additional safeguards. Solution. Implementing Clinical Decision Support Systems, CDSS, within e-prescribing platforms can significantly enhance patient safety. CDSS tools alert providers to potential drug interactions, allergies, or dosage errors before prescriptions are finalized. By integrating CDSS, providers can avoid prescribing medications that could harm the patient, further enhancing the safety and quality of care. 3.3. Continuous monitoring and auditing. Problem. In multi-provider environments, there is often a lack of oversight and monitoring to ensure that prescriptions remain appropriate over time, leading to possible medication overuse or misuse. Solution. Regular auditing of e-prescribing practices can help identify and correct errors or inefficiencies in the system. Providers should continuously monitor prescription patterns, conduct peer reviews, and analyze patient outcomes to ensure that prescribing practices are effective and in line with clinical guidelines. Utilizing e-prescribing tools to track and audit prescriptions can also help prevent fraudulent activity or misuse of controlled substances. 3.4. Provider collaboration and communication. Problem. In multi-provider settings, inadequate communication between providers can lead to medication discrepancies and incomplete treatment plans. Solution. Encouraging regular communication and collaboration between healthcare providers is key to ensuring the quality of prescribing. E-prescribing platforms can facilitate this communication by allowing providers to share notes, updates, and recommendations in real time. Joint decision-making and case discussions can improve the consistency and quality of prescriptions, ensuring that all providers are aligned in their approach to patient care. 3.5. Patient education. Problem. Patients in multi-provider settings may receive conflicting medication instructions or fail to understand the purpose and proper use of their medications. Solution. Providing patients with clear, consistent instructions about their medications is vital. E-prescribing systems should allow providers to include detailed medication instructions, potential side effects, and the importance of adherence to prescribed therapies. Additionally, providers should take the time to educate patients about the rationale behind their prescribed treatments, ensuring they are well informed and more likely to follow the prescribed regimen.